नमो शारदा. धन्यवाद महोदय. As a token of gratitude from ILBS, now we may please request the Director, sir, to welcome Chief Guest, Dr. Rajiv Behel, Secretary, Department of Health and Director General, ICMR. May I please request Dr. M.K. Daga, sir, to welcome Dr. Badri Thapa, Team Lead Communicable Diseases, WHO India. Thank you, sir. We welcome you all on the occasion of World Hepatitis Day. Viral hepatitis is one of the biggest global health threats of our time. We celebrate Hepatitis Day every year on 28th July for bringing together all under a single theme to raise awareness of the global burden of viral hepatitis and to influence the real change. The theme for 2025 is Hepatitis, Let's Break Down. Let's break it down, call for urgent action to dismantle the financial, social, and systemic barriers, including stigma, that stand in the way of hepatitis elimination and liver cancer prevention. Now, may I please request Vice Chancellor Dr. M.K. Daga, sir, to present the welcome address and the objectives of the event.
Good morning to the dignitaries on the dais, off the dais, my dear colleagues, friends, those who come for checkup on this day. I think there is no doubt that Professor Sareen, our Chancellor and Director, is leading this fight for now more than, I think, 2 or 3 decades of fighting against hepatitis. And I remember in my earlier days when he was my colleague at Maulana Azad and GB Pant, his passion still continues to that level. I think it is much more than what it was there at that time. So, but at the outset, let me welcome our chief guest, Dr. Rajiv Behel, who is a known pediatrician and a lot of work in, I think, epidemiology and child health. The morning round he took of the facility in the research showed his enthusiasm and his commitment. And we are very glad to welcome you, sir. And we continue to hope to have your cooperation in years to come. It's a great day for the Institute. I also welcome Mr. Badri Thapa, who is representing WHO. And when WHO is associated with us for quite a long period now, and I hope we will continue to have that association, a fruitful association for the betterment of the humanity at large. And we'll continue to work on eliminating this. I know B is a little tricky because some patients may require a lifelong treatment for a longer period. Although for against C, we do have some treatment. The problem is that both of these diseases can lead to chronic liver disease, cancer of the liver, and then a very grim scenario for the affected patient. So it's a challenge, and I hope that we continue to collaborate with WHO on this field. For Professor Sareen, I can only say one word, that his guidance and his enthusiasm, his passion, which is making us work hard. Maybe we need to put in more work now to, carry his dream forward of controlling hepatitis. And I hope that we will, with continued collaboration, research, be able to carry that forward. So I welcome you all for this World Hepatitis Day celebration. Thank you.
Thank you, sir. The theme, let's break it down, emphasizes the need to simplify, scale up, integrate hepatitis services, be it vaccination, safe injection practices, harm reduction, and especially testing and treatment in national health systems. The campaign is a reminder that we must now expand the access, integrate care, and end hepatitis as a public health problem by 2030. On this, may I please request Dr. B. Vari, Professor Epidemiology and Public Health Specialist, ILBS, to address the gathering on global and Indian scenario of viral hepatitis.
Honorable Dr. Rajiv Bahl, the chief guest, Dr. Badri Thapa, Dr. Sareen, esteemed faculty and participants. I would just like to give you a brief overview of why we are talking of Hepatitis Day and what is the magnitude of the problem. Viral hepatitis is the only communicable disease where mortality is increasing. The mortality due to HIV, due to TB has come down significantly. We have controlled many infectious diseases, but viral hepatitis mortality is still increasing. 1.3 million people died of viral hepatitis in 2022. And you can imagine that this was 3,500 deaths every day happening because of viral hepatitis, which is highly unacceptable. We have got more than 30 crore people living globally with hepatitis B and C, 25 crore with B, 5 crore with hepatitis C. And when we come to India, India contributes almost 11% of hepatitis B and C burden. Our prevalence is low, but because of large population, the estimated burden is 3 crore people live with hepatitis in India, B, and 50 lakhs with hepatitis C. So that is a significant number. And what is basically disturbing is that we have got now a cure for hepatitis C. We can cure 95% of patients with hepatitis C. We have very effective, cheap drugs for hepatitis B. But globally, only 15% of people with hepatitis B know that they are infected. US don't know they are even infected, and just 3% get treatment, which is unacceptable that we are not able to provide a treatment which costs as low as 2,000 rupees for cure. But the problem is not with the treatment. Problem is the detection, because it's a long asymptomatic phase and people don't know their status. So 1 in 10 people only know their status that they are infected. That is the purpose that we hold Hepatitis Day, to raise awareness about hepatitis, get people to bring and get tested so that they can be treated if they are infected. WHO has basically called for elimination of hepatitis B as a public health threat by 2030. 20% reduction in new infection and 65% reduction in the deaths. So government of India, along with support from WHO, is doing a lot of activity. I would like, with your permission, sir, would like to highlight some of the work ILBS has done in this regard over the years. Government of India came with the viral hepatitis program in 2018, but ILBS has been holding technical meetings for having a viral hepatitis control program since 2014. 2000 to 2017, we held 4 technical consultations on Hepatitis Day as a advocacy. And I was here from WHO in 2017 when Mr. C.K. Mishra came in and he announced we will have a program next year. In 2018, the program was launched. So ILBS has contributed significantly to this work under the dynamic leadership of Dr. Sareen. In addition to this advocacy, we have also been doing a lot of public outreach. You might have seen the van outside. We have a health van which has got facilities like hemoglobin, blood sugar, lipid profile, hepatitis B, C testing, and even fibroscan. A fibroscan is an investigation which is not available in most of the government hospitals in India. It is becoming available at some sites, but ILBS had this 4 years back, And we have already scanned more than 45,000 people to determine their liver stiffness. We have also implemented number of other programs. Sir, Dr. Bell, I would like to emphasize that ILBS done a same-day screening and testing for hepatitis C, which was done by Dr. Ekta Gupta and Mohalla clinics. So this was an initiative which has been recognized globally as a same-day treatment. We also, sir, have a ICMR training research center with ILBS for last 2 years. And we have number of other activities. We'll go through that in detail later. Empathy program, womb program, and we have got SMILES, which is having a stronger India through million educated students, where we already reached out to more than 60,000 students, and now we have young SMILES. So these are some of the glimpses. I will not go into more details considering the time constraint. These are some glimpses where ILBS has been supporting the elimination of hepatitis program in India. Thank you very much.
Thank you, sir. We are privileged to have Dr. Badri Thapa, global public health professional with 20 years of experience in communicable diseases in Asia and Africa region. He is a medical graduate with a PhD in medical microbiology and MBA in health project management. Recipient of the Public Health Excellence Award, Dr. P.S. Ranganathan Memorial Gold Medal, Mahidol University, Dean's Award, and UN Medal for Humanitarian Work in Burundi. Dr. Thapa is currently working as the team lead, communicable disease in India. We request to kindly address the gathering.
Thank you so much. Respected Dr. Rajiv Ban, Secretary DGHS, ICMR, Dr. Sunita Sharma, DGHS, MOH, FW, but she will be here very soon. And Professor S.K. Sarin, Director, ILBS, and Dr. M.K. Daga, Vice Chancellor, ILBS, and Dr. B.B. Rewari, Professor of Epidemiology, ILBS. And dignitaries and faculty members of ILBS, partners organizations, and ladies and gentlemen, and good morning to you all. First of all, I'd like to mention that I am representing here for Dr. Rodrigo Offrin, who couldn't be here because of his traveling currently, and sincere regret from his side to our chief guest and to Professor Sarin. I think Dr. Rewari already highlighted the issues of viral hepatitis globally. And I would also reiterate this again because, just to bring to the highlight again. So viral hepatitis is a global public health challenge with over 304 million people living with chronic viral hepatitis B and C. Chronic hepatitis B and C silently cause liver damage and cancer, leading to significant morbidity, mortality, as well as huge economic consequences. Despite being preventable and treatable, globally, more than 6,000 people are getting new infection daily. And Dr. Rewari already mentioned that of those who are getting new infection, just 3% are on treatment for hepatitis B and 20% for hepatitis C. 3,500 people are dying due to hepatitis B and hepatitis C infection each day, which is 1% dying every 30 seconds from a hepatitis-related illness. Globally, there is an urgent need to accelerate action on better prevention, diagnosis, and treatment to save lives from chronic hepatitis. India is among the top 10 high-burden countries for hepatitis, accounting for 11% of the global hepatitis burden. The National Viral Hepatitis Control Program, launched in 2018, has made significant progress in making prevention, diagnosis, and treatment services available across the country through an integrated approach. So I would like to congratulate the national program, the leadership of Director General Health Service, Ministry of Health and Family Welfare, and all the partner organizations for all the efforts and commitment to combat hepatitis in India. The Institute of Liver and Biliary Sciences, a WHO collaborating center, continues to demonstrate excellence in public health through its cutting-edge research, clinical care, and capacity-building initiatives. Its commitment to advancing liver disease management and contributing to national health priorities, including hepatitis elimination, is commendable. The institution's leadership in fostering innovation, training, and partnership reflects its pivotal role in strengthening India's healthcare system. And Dr. Rewari already mentioned this morning when we had an interaction that, and also in his opening statement, that the public health outreach activity that is done by ILBS is very commendable. That is, providing services basically access, so that a lot of people are getting screened for liver diseases. And ICMR has made significant contribution to the liver disease research in India, especially in viral hepatitis. Its work in diagnostics, surveillance, and implementation research of national high priority projects has strengthened national efforts towards hepatitis elimination and liver health. We have the knowledge and tools to prevent, diagnose, and treat viral hepatitis. We have safe and effective vaccine that can prevent hepatitis B infection. Antiviral drugs are highly effective in controlling and preventing disease progression, managing chronic hepatitis B, and curing most cases of hepatitis C. More is to be done for these life-saving interventions to benefit each person, irrespective of who they are and where they live. Hepatitis B and hepatitis C affects certain specific population, including key populations such as people who inject drugs, prisoners, sex workers, and men who have sex with men. It is important to keep the needs of people living with hepatitis at the center of all efforts and deliver service closer to communities at the primary healthcare center level. The theme of World Hepatitis Day 2025 is Hepatitis, Let's Break It Down. This calls for urgent action to dismantle the financial, social, and systemic barriers that stand in the way of hepatitis elimination and liver cancer. It is a reminder that we must act now to expand access, integrate care, and end hepatitis as a public health problem by 2030. Further, the WHO Global Health Sector Strategies on HIV, hepatitis, and STI call for advancing triple elimination of mother-to-child transmission of HIV, syphilis, and hepatitis, which focuses on a harmonized approach to improve health outcome for mother and children. HIV, syphilis, and hepatitis can cause significant maternal and child health morbidity and mortality. Vertical transmission for all three infections can be prevented through simple intervention anchored on common platform of RMNCH. Given the similarity of this intervention, WHO encouraged for simultaneous commitment to eliminate vertical transmission of HIV, syphilis, and hepatitis B virus as a shared goal. We have the collective responsibility to save lives today and protect the health of future generations. And I'm sure together we can do it. And let's break hepatitis down. And Nepal.
Thank you, sir, for the encouraging words. One of the most studied and yet neglected consequences of hepatitis is liver cancer. To enlighten us on pathways to liver cancer prevention through hepatitis elimination, may we please request Dr. S.K. Sarin, sir, Director ILBS, to kindly address the gathering.
Wish you all a very happy and very purposeful World Hepatitis Day. Thank you all for joining. And my grateful thanks to Dr. Bal, who I know was very tightly placed today morning because of a major meeting of secretaries. He pushed it and he came here. And this is his first visit, and I'm immensely grateful to you, sir. As a core researcher and strategist, he was to come at 8:25, but he came at 8:20. He saw the whole research facility individually going into meeting the students, encouraging them, and encouraging all the faculty here to apply for MD, PhD programs. We had last year 4. This year, the date is 31st of July. So you can all apply for and become a clinician scientist by joining ICMR supported MD PhD program. With that, I also welcome Dr. Thapa for making it possible, and WHO and all of you who have come. The journey of hepatitis for me started way back in 95 when I saw so much of hepatitis B and patients dying. In 98, we launched in the country the Yellow Ribbon campaign about 12 years before WHO. And whole of Delhi, there used to be, and that was December 4th. December 1 is your HIV day. And it so happened that on December 4, we were holding a conference and Ram Jethmalani, the then law minister, was there. And at that time, we thought, and he said also that why don't you have a national movement? And his daughter Rani Jethmalani, who had hepatitis C, was also, she couldn't get a liver for 15 months. And the whole journey started. She had liver cancer and hepatitis C. I don't remember, sorry, whether she had cancer or not, but she had hepatitis. There are several occasions when a clinician thinks he is no good. And today is one day when we all feel that what is preventable is not prevented. Liver is your main metabolic factory, but there are three things affect it. Alcohol, you all know, fat, and virus. Viral hepatitis is something totally preventable. And as Dr. Thapa said, so many people die one every 30 seconds. The number of liver cancers in the country is growing, and today, as per the report from Tata Memorial, 1 in 3 cancer deaths are due to liver cancer. This is totally preventable. A large ILBS study showed that 39% of liver cancers are due to diabetes or related to diabetes people. And fatty liver is core to diabetes. In fact, diabetes is a liver disease. So two things very clearly: viruses you can prevent and fatty liver you can prevent. Alcohol is your choice. You want to indulge and get into it, well, that's your choice. Let me briefly tell you about how you can prevent liver cancers. The primary prevention is don't insult your liver or let it be insulted. मतलब लिवर में चर्बी जमा होना या फैट जमा होना लिवर की इंसल्ट है, को बर्डन करेगा और धीरे धीरे वही फैट थोड़े समय में स्कारिंग करके सिरोसिस, और जिनको लिवर से फैट के कारण सिरोसिस है 3 से 12% में लिवर कैंसर होता है। तो अगर फैट है और उसके बाद सिरोसिस का रास्ता है तो 3 से 12% लोगों में जिनको सिरोसिस है हर साल लिवर कैंसर हो सकता है। ILBS में we see about 1100 new liver cancers a year, maybe more than any other including TMH. And it pains us every time when you see a liver cancer. उसको पता ही नहीं, सर मुझे पता नहीं था, मैं तो ठीक था, मैं तो पीता भी नहीं था, फिर भी हो गया। अच्छा भाई, you are slightly bulky, तुम्हें डायबिटीज था। और तो एक रास्ता जो सब लोग आज हैं अपने अपने परिवार को, अपने दोस्तों को बताएं कि कैसे लिवर से फैट निकालें। दूसरा रास्ता जो लिवर कैंसर से बचने का है वो है वैक्सीन। हेपेटाइटिस बी एक लिवर कैंसर करता है, जिनको हेपेटाइटिस बी है और जनरली माँ से बच्चे को आती, एंड इफ द मदर इज पॉजिटिव तो सारे कंट्री में एंटीनेटल स्क्रीनिंग है, और उसके बाद में अगर बच्चे पैदा होते ही 12 घंटे के अंदर उसे फर्स्ट डोज वैक्सीन की लग जाए। सर इज ए डॉक्टर बाल इज ए पीडियाट्रिशियन par excellence, so he would probably support that we have to move forward. Our birth dose coverage is only 63% and that too also institutional. बाकी लोगों को नहीं लगती, तो सबको हेपेटाइटिस बी का वैक्सीन फ्री मिलता है, नेशनल वायरल हेपेटाइटिस कंट्रोल प्रोग्राम में लगवाना है, और फिर 6 हफ्ते, 10 हफ्ते, 14 हफ्ते, 4 डोसेज फॉर लाइफ। द नेक्स्ट जनरेशन इज सेफ। तो हेपेटाइटिस बी से कैसे हम लोग मुक्त होंगे? Every newborn, take a pledge from today that every newborn will be vaccinated properly. Number 2, जिन लोगों को इन्फेक्शन है हेपेटाइटिस बी का उन्हें दवा दे दीजिए। जैसे HIV वाले को दवाई दी है तो HIV दबा रहता है, हेपेटाइटिस बी की दवा दे दीजिए। दिस इज बियॉन्ड गाइडलाइन, सो डोंट डू ट्रीट सेलेक्ट, ट्रीट ऑल। If you treat everybody, the transmission is decreased. तो सोर्स खत्म हो गया, नई जनरेशन प्रोटेक्ट हो गई, then you will need about 40 to 50 years to eliminate hepatitis B totally. The WHO goals will take a lot of time, but we should take the first step today, take a pledge that we will protect new generation and we will treat all infected. तो उन्हें कैंसर नहीं हो, वो बीमार ना पड़े, सिरोसिस नहीं. हेपेटाइटिस सी वेरी इजीली ट्रीटेबल, उसको ट्रीट करें और कैंसर को बचाएं. कैंसर से बचने के और कई आसान तरीके हैं. जिन लोगों को हेपेटाइटिस बी या सी का खतरा, या बाकी लोगों को अगर वो एस्पिरिन ले रहे हैं, एस्पिरिन कैंसर से बचाती है, स्टैटिन्स कैंसर से बचाते हैं, स्मोकिंग कैंसर बढ़ाती है, अल्कोहल कैंसर बढ़ाता है, मोटापा कैंसर बढ़ाता है. और हाँ, जीवन शैली में अगर वजन घटाएं या एक्सरसाइज करें, खाली कहने की बात नहीं है कि एक्सरसाइज से हेल्थ होती है, सारे कैंसर कम हो सकते हैं. कैसे? लिवर में अगर फैट होती है, उसी से सारे लिवर के कैंसर और एक्स्ट्रा लिवर कैंसर होते हैं. जैसे ब्रेस्ट कैंसर, जिनके शरीर में लिवर में फैट है, ब्रेस्ट कैंसर कभी 70% ज्यादा, उनके फूड पाइप के कैंसर ज्यादा, उनका स्टमक कैंसर, प्रोस्टेट कैंसर या कैंसर ऑफ कोलोन, ये सारे कैंसर जिन लोगों के लिवर में फैट है वो ज्यादा है. तो क्यों नहीं उसे छुट्टी पाए, फैट कम करें, थोड़ा वर्जिश करें. जो लोग वर्जिश करते हैं उनका लगभग 15 से 20% कैंसर होने का खतरा बच जाता है. ये सब बातें सिंपल भाषा में इसलिए बता रहा हूं कि हम सोचते हैं मुझे क्यों हो गया. अरे भाई, तुम पूरे उठे ही नहीं, 40 साल से सिर्फ टीवी देख रहे हो या बैठ के गाड़ी में घर से ऑफिस जा रहे. So those people who you can reach, please read this science today. It is everyday science. The cancer is can be reasonably reduced by reducing body inflammation. Obesity, fat are reasons for inflammation in the body. On this hepatitis day, we need to see that the 5 viruses that we have, small finger हेपेटाइटिस ए बच्चों में होता है, बी, सी और डी ये तीनों ब्लड से जाते हैं, और हेपेटाइटिस ई भी भोजन और दूषित पानी से है. तो ए और ई तो खाने की आदतें सुधार लें, हाथ धो के. और दूसरा, अगर आप बारिश के मौसम में बाहर भी खाएं तो गर्म खाना खाएं. तो ए और ई इज फूड एंड वाटर. इफ इट इज नॉट, इफ इट इज सेफ, यू आर सेफ. बी, सी एंड डी आर ब्लड बॉन्ड, मेरे से दूसरे में जाएगा, हस्बैंड से वाइफ में, वाइफ से बच्चों में. हेपेटाइटिस बी इज जनरली मदर बेबी ट्रांसमिशन. और अगर हम मदर को टेस्ट कर लें और बच्चे को प्रोटेक्ट कर लें तो बच जाएगा. और हाँ, ILBS ने थोड़े बहुत काम इसमें किए. नेशनल वायरल हेपेटाइटिस कंट्रोल प्रोग्राम 2000 उसका शुरुआत हुई 18 के अंदर. We were able, and the ICMR supported many of our activities. ICMR has also given us several grants. One of them is liver regeneration grant, and we are very proud to say that Dr. Bal today visited the lab. I'm also very thankful to the departments who are doing the work on public awareness, like Dr. Evari, the team which are going into outreach programs, and all our team in virology, they all have helped. I also hope that WHO, we are a WHO nodal center for cancer for the country, we represent the CRO, also recognizes the talent that exist. Each one of the 73 faculty members are institutions in themselves. So if you would like to use the talent here for prevention of cancer or detection or management of cancer, making a cancer grid. Also, if ICMR or you can help in making a registry for liver diseases, we will be very happy. My 3 or 4 small requests to the DG, ICMR and Secretary DHR are: 1 is to include ILBS. We are a very small institute compared to All India or JIPMER or PGI. a very small group, but they are dedicated. So if you can include them into the national programs, as you have mentioned, we'll be very privileged. We would also like our labs and our talent to be utilized anywhere. We'll be ready for epidemics. Unfortunately, if something happens, so we will be ready with our basic science laboratory. So second request is to include into national emergencies or creating. And third is to support the faculty and the students, as you have always shown your interest for their growth and for their future in the career. With these, my profuse thanks to you for joining us today, and wish you all a very happy, prosperous and useful World Hepatitis Day. Thank you.
धन्यवाद महोदय। अत्यंत सरल शब्दों में आपने इतनी गंभीर बीमारी के बारे में बताया, इसके लिए आपके आभार। As sir has mentioned, ILBS has been running various community initiatives, various programs for hepatitis as well as NAFLD. And in order that the science reaches the masses and they are able to understand it, we have to have a simplified way of explaining them so that research turns into reality. Every year we have a pledge for hepatitis control, and this year we are having a poem so that it reaches masses and inspires them, encourages them to undergo testing and have awareness about hepatitis and liver cancers. It says, let's break it down. Let's break it down. It says, let's break it down. Louder, let's break it down. The silence, the wall. The stigma that shadows. The systems that stall. No more delay. The time is now to lift up voices and show them how. The burden is heavy, the cure within reach. Yet barrier remains in policy and speech. Cost must not silence a life-saving test, or shame be the weight on an alien chest. Let's act with courage, compassion and grace to end hepatitis. Let's heal every place. Let's break it down. The myths and fear. Bring silent hepatitis out clear. With knowledge strong and voices loud. We fight the virus, fierce and proud. Test and treat. Don't wait around. In every heart, let hope resound. No more shadows. No more delay. Together we mark this Hepatitis Day. One world, one fight. No backing down. Let's break it down from street to town. Thank you. We are also proud to announce that under the vision of Dr. Sareen, ILBS has started empathy, that is empowering people against hepatitis. Now, a collaborative initiative between ILBS and ITC Limited's Illness to Wellness vertical, it has reached 24 million individuals between December 2023 to March 25 through a wide range of impactful activities. Over 1,400 patients enrolled on the Empathy Patient Network. Supported by the launch of dedicated helpline, youth engagement was fostered through the Happy Schools Art and Essay competitions, which received 178 entries, and global cartoon contest that garnered 823 entries from 53 countries. High visibility campaigns featuring videos by Mericom broadcast across 60 cinemas and multiple Delhi metro stations. One campaign organized panel discussions, awareness drives, and video testimonials to destigmatize hepatitis among the mothers and many such outreach activities. Today, we release the report of the empathy campaign. This is the best example of science reaching the masses, where it is actually produced, going from lab to the society, to the community. Thank you, sir. We are privileged to have amongst us Dr. Rajiv Bahl, who is a physician scientist with specialization in pediatrics and public health. He received an honorary doctorate from University of Bergen, Norway in 2022 in recognition of his contributions to maternal and child health research. His prolific scholarly output includes over 250 papers in various journals and is among the top 1.25% scientists in the world across all the disciplines. His notable contributions to major innovations for newborn and child health includes use of zinc in the treatment of diarrhea, early initiation and exclusive breastfeeding, outpatient treatment of newborn with severe infections, and immediate initiation of the kangaroo mother care after birth in mother newborn intensive care units. We request sir to kindly address the gathering.
Respected Professor Sareen, Dr. Thapa, Dr. Devari, Dr. Daga, the faculty, staff, students, and other ladies and gentlemen who are in this room. It gives me immense pleasure to be here today in this wonderful institution on the Hepatitis Day. And I had a few talking points that were sent to me, which I will not talk about after what Dr. Sareen beautifully explained. Almost everything around both prevention, management, not just of hepatitis, but of major liver diseases, including alcoholic hepatitis, fatty liver, and the consequences and cancer. So just to say, I just want to add my voice to the fact that how important it is for us to eliminate hepatitis. As Professor Sareen and Dr. Revari, Dr. Thapa all have said, it is totally preventable and unnecessary deaths occur every year. So this is something which, for me, for India to eliminate is just part of our journey to Viksit Bharat. We want to be a developed country. We will have to at least do this much. So these are all, when we say Viksit Bharat, it is not something imaginary or something wonderful that will suddenly emerge. These small things that we all are facing, once we are able to get over them, it's only then we are going to become Viksit Bharat. Another thing that I, as Dr. Sareen said, I came here for the first time. I've never been to ILBS. I wasn't here when ILBS was established. I was at the World Health Organization from 2003 till 2022. And ever since I have been at ICMR, usually I don't like to go to any ceremonies and functions. And the reason is that I would like to actually dedicate my time, which is very limited. It's a tenure job, just like you all have tenure jobs, but your tenure can be extended. But for this job, the tenure is pretty fixed. So we have limited time. And therefore, I asked Professor Sareen when he offered that I could visit the facilities for research and meet the researchers.
it was a great pleasure, and I said that I will come in the morning and first for half an hour or 45 minutes do that and then come here. So what I want to add is that the vision that Dr. Sareen has shown in not only having ILPS as one of the best clinical facilities and teaching facilities, but also one of the best laboratory facilities for research on liver diseases is so commendable. And so it is really worth watching. I would really commend you and appreciate what you have done within the government system, but created a different model of how things can be done. Indian Council of Medical Research has had several collaborations and several projects, including senior research fellows, research grants that have been won by ILBS and will continue to do so. The only thing I would like to say is, what I like is, and these 3 years, what I have tried to do is, rather than give institutions priority, we have said that everything should be competitive. You must compete to get grants. And in fact, now if you get any grants, you can actually be proud that it is not because you are ILBS. It is because, or you are All India Institute of Medical Sciences. It's because you wrote a proposal and you wrote it in a way and you presented in a way, if it was a Center for Advanced Research, that you were selected by the Indian Council. I want to make it something which is worth being proud of. If you get even one ICMR grant, you should be very proud of that. And there are several that you have. So I am really happy to see that you all are. So we can only become, and my view is we can only become world class if we do that, if we can compete, if we can get the best research projects written, the best studies done, etc. So having more attention to how we conceptualize ideas, how big, how great the ideas are. So I was having a scientific advisory board meeting day before yesterday of ICMR, and I told them about what ICMR have done. Recently, we have come up with research and innovation, and ICMR research and innovation impact scale, and essentially have converted everything that you do, whether it is research publications, patents, use of research in public health, use of research in clinical medicine, use of research or patents converted into technologies and products, and even commercialization of products. All have been converted to one single currency, which I have called publication equivalent. And what I have started doing is now asking everybody to look at, when you get an idea, look at what do you expect, how many publication equivalents will it get when you are doing a research study, when you are making a proposal. What is the level of impact that you see? Impact is not from publications. Impact is use of that research information and use of the innovations. So if you want to, it will come out in the Indian Journal of Medical Research soon. I would like you all to read it and think about it, that any research project you make, it should have a reasonable number of expected publication equivalents for you to succeed in not only getting the grant, but also making your research more impactful. Because we do a lot of research in India. We publish one of the largest number of papers, but we do not do a large proportion of it is not impactful research. It is research to tick boxes, research to get promoted. First, you do research to do your MD thesis or your DM thesis, or you do research just to get a PhD. But when I compare, or all PhD students, there are some in this room, I guess. Please raise your hand if you are a PhD student. Yeah, there are a few. And there are many who are their guides. When I see a PhD student in India, and I'm told that अभी तो PhD कर रहा है, वो थोड़ा सा ऐसे ही प्रोजेक्ट करेगा, थोड़ा low level, then I get very pained. Because when I see the PhD students in the United States, for example, they are doing things which are at the cutting edge of what research is being done globally. And ILBS is different in many ways. I saw this morning that you are involving your PhD students in cutting edge research. We should involve our youngest people, youngest minds in the best research that we are doing in our institutions. And I saw some evidence of that today. I am not sure it is 100%, but that should be our direction. We should get our PhDs and our DMs. So when you do a fellowship from Harvard or Johns Hopkins University, you are an accomplished researcher. Whereas when we do a DM, we are making our doctors, DM is a kind of a glorified MD in a specialized subject. It is the research which is the difference. You have such good facilities, and I'm sure your DM students, etc., are also, you told me that they are involved with some good research projects, etc. So this is something which we should all, from the very beginning, think about, that it's not enough to do research. We do research to solve problems. You do research to do exactly what Dr. Sareen said. We want to eliminate hepatitis. We want to reduce the cancers to a bare minimum. We want to reduce fatty liver disease. We want to test interventions that will come, which will solve the problems that we want to do. Also, I saw at ICMR in the beginning, there was so much of research that was just focused on describing the genomics, the proteome, metabolome, etc., which is good. But we also need to then take that knowledge forward and find solutions to the problems that we are having. And that is where why I thought you got your Center for Advanced Research on Stem Cells and Regenerative Medicine, because you will be able to solve a problem of, something that today we do not have a solution to, or the solution is very complicated or very difficult, and people have to wait a long time to get that solution. So I just would like to encourage you all to keep working on research in addition to clinical care and training and teaching. And for those people who work on research, to think about the impact of your research. And I'm sure you all will go places. This institute has been really, it has taken off beautifully. And I hope that in the decades to come, it will become one of the most wonderful institutions of the country and of the world. Thank you. Jai Hind.
Thank you, sir. Highlighting the importance of integrating research with clinical practice, Dr. Behel said that future of Indian healthcare rests in our ability to develop new interventions and diagnostic tools. ICMR's focus on evidence-based research, combined with its commitment to training physician scientists, is essential for India's journey towards self-reliance in medical technology. On the similar lines, sir, ILBS has partnered with institutes like IIT Delhi and other AI hubs as well for leading the innovations in liver care and bringing research to reality for patient care. And we seek support of ICMR in this journey of Viksit Bharat. Thank you, sir. And indeed, research for patient care is the only religion we follow at ILBS. With this, now may I please request Head Operations, Lieutenant Colonel RSC, to kindly present the words of thanks.
Good morning, everyone. It's my proud privilege to deliver vote of thanks today. At the outset, I would like to put my sincere gratitude to Dr. Rajiv Bahal, the Secretary, Department of Health Research and Director General ICMR, for sparing his valuable time and gracing the occasion. Sir, thank you very much for coming early in the morning and visiting our research facilities and also encouraging our students and the faculty in the research departments. We are grateful to you, and we hope that your support will continue in future also. Thank you, sir. I'm also grateful to Dr. Badri Thapwa, the team lead communicable diseases from WHO, for sparing his time and coming over here. We hope that the support of WHO, which has been there for since long, will continue in future, sir. Thank you very much, Dr. Badri Thappa, sir. We are forever grateful to our director, sir, and the Chancellor, Dr. Shiv Kumar Sarin, sir, for always leading the team ILBS from the front and guiding us, motivating us. And he has enlightened us. He has been enlightening us always and today also in very simple words how to prevent hepatitis and make world and India hepatitis free. Thank you very much, sir. We are also thankful to our Vice Chancellor, Dr. M.K. Daga, sir, for supporting us in organizing this function. We are thankful to Dr. B.B. Rewadi, Dr. Kanika and its Department of Epidemiology for organizing this function. I am also thankful to Dr. Ekta Gupta, Dr. Minu Vajpayee, Dr. Pratibha Kale, and Dr. Archana Rastogi for supporting us in organizing this function. Also, I am grateful and my heartfelt thanks to Dr. Arun Rastogi and his team of Department of Medical Operations and all the administrative staff for helping us in this function, especially the Department of HR, Admin, Security, IT, Hospitality, and Housekeeping. Thank you very much. And lastly, and most importantly, I'm thankful to all of you, especially the faculty, the students, staff, and all the persons who have come for this screening. Thank you very much for coming over here early in the morning and making this program a success. Thank you very much.
I request you all for a group photograph. May I please request Rastogi sir, Dr. Saraya, Dr. Minu, Dr. Ekta to please join on stage for a group photograph. Dr. Seema ma'am. Colonel Ram sir, kindly join us for the photograph, sir. Thank you, sir.
Mm.